Diameter phi 8 to phi 11. Length: 255 millimeters, 2375 millimeters. Use a transparent ruler to determine the length and diameter. When choosing the length of the main nail, consider the pressure needs. If you want to actively pressurize, you should choose a shorter nail. The maximum is 6 millimeters. In AP view, the entry point is in line with the axis of the intramedullary canal and with the lateral tubercle of the intercondylar eminence. In lateral view, the entry point is at the ventral edge of the tibial plateau. Make a gentle hole at the entry point. In lateral view, it's at a 10 angle to the shaft. Insert the threaded guide pin about 8 to 10 centimeters. Check the position of the thread guide pin in a P and lateral. Pass the drill and drill protection sleeve through. Insert the thread guide pin into the bone. The drilling depth is about 8 to 10 centimeters. The needle and drill cannot touch the posterior cortex. Remove the guide pin. Drill and drill protection sleeve. Insert the reduction rod through the fracture line. Through the reduction rod, insert the ball tip guide pin to the farthest end. Remove the reduction rod. Insert the ball head guide needle soft drill. Start to use a 7.5 mm soft drill to ream. Increase the diameter by 0.5 mm. Enlarge the medullary canal diameter to 1 mm, larger than the diameter of the intramedullary nail. Do not reverse the soft drill when removing it. Clean debris from the medullary canal. Insert the main nail into the medullary canal. Avoid fracture displacement when passing through the fracture line. Insert it further until the end of the main nail is flush or below the tibial opening. If necessary, you can install a main nail insertion and removal connector. Determine the final position of the main nail in the laterate view. Connect the distal rod to the handle. Install the distal lateral aiming frame on the inside. Use the connecting lock wheel to lock it. Insert the soft tissue separator into the positioning hole. Insert the soft tissue separator and make a 5 mm incision directly below. Insert it directly into the bone cortex. Remove the soft tissue separator. Use the positioning drill sleeve. Use 5.2 positioning rod drill bit. Drill the distal platform positioning hole. Remove the bone drill. Use a 5.2 flat-headed drill to remove bone chips until you hear or feel the metal sound of the flathead drill and the main nail. Remove the flat drill and drill sleeve. Insert the T-shaped positioning rod and secure it with a positioning block. Into the distal hole on the distal lateral aiming frame, insert the soft tissue separator and outer sleeve and make a 5 mm incision. Insert the reamer into the bone. Remove the soft tissue separator. Insert the 4.0 inner sleeve. Use a 54.0 drill to drill through the first layer. When reaching the inner side of the contralateral cortex, use a small L-shaped wrench to adjust the limiter on the drill, about 8 mm away from the inner sleeve. Continue to drill through the contralateral cortex. Remove the drill and inner sleeve. Insert a right-angle positioning rod for temporary positioning. At this time, a ball-tipped guide pin can be inserted. Check if the temporary positioning rod is inserted into the nail hole. Through the parallel holes at the proximal end of the lateral aiming frame. Repeat the drilling operation. After drilling, remove the drill and inner sleeve. Keep the outer sleeve close to the cortical bone. Insert the depth gauge to measure. Select the appropriate length of 4.3 locking screws and screw it in with a SW 3.5 screwdriver. Remove the screwdriver and outer sleeve. Remove the right angle positioning rod. Repeat the step of screwing in. Complete the insertion of parallel hole locking screws. Confirm the screw placement effect under X-ray. According to the needs of the fracture type, the above operation can be repeated. Insert the third and fourth 4.3 locking screws. Remove the distal guide rod. Install the proximal lateral aiming frame on the handle. Insert the proximal 4.3 locking screw. Is the same as the insertion method of distal 4.3. After inserting the first proximal dynamic locking screw, you can choose whether to apply pressure or not. Screw the pressure rod from the end of the handle and contact with the dynamic locking screw. Push the pressure rod until the fracture gap is reduced. Control the reduction on the fluoroscopy. Each rotation of the pressure rod can add 1 mm up to 6 mm. Hold the position after the pressurization. Insert the second 4.3 locking screw. Remove the pressure rod and lateral aiming frame. According to the needs of the fracture type, 3 4.8 locking screws can be placed. The locking operation is as follows. Install the proximal aiming frame on the handle. Tighten the screw with an L-shaped wrench. Insert the 4.8 locking sleeve combination. Insert the cannula needle into the bone surface. Remove the cannula needle. Make sure the drill sleeve is pressed against the proximal cortex. Use a limited drill to start drilling the proximal cortex. Stop immediately after drilling through the proximal cortex. Do not penetrate the contralateral cortex. Monitor the position of the drill under fluoroscopy. Drill to the desired depth. Drill from the end of the drill sleeve. Read directly the length of the 4.8 nail. Remove the drill and drill sleeve. To avoid penetrating the contralateral cortical bone, it is recommended to use screws 5 mm shorter. Use SW 3.5 wrench through the protective sleeve and screw in the 4.8 mm locking screw. Verify the screw length under fluoroscopy. Repeat the above steps. Insert 2 other 4.8 locking screws. Remove the handle and aiming frame. Flex the affected knee joint. Insert the tail cap with the tail cap holder along the main nail. First rotate counterclockwise and then clockwise to screw in. Tighten it with a SW 3.5 wrench. Clear the soft tissue in the hexagonal grooves of the tail cap. Use ASW 3.5 wrench to remove all the locking screws. Leave one proximal locking screw. Remove the tail cap. Tighten the main nail driving rod to the locking nail to prevent the main nail from rotating or displacing. Before removing the last proximal locking screw, connect the sliding hammer guide rod to the main nail driving and pulling connecting rod. Use SW 3.5 wrench to remove the last locking pin. Hit the guide rod with a sliding hammer to remove the main nail. The operation demonstration is completed.